We will be able to deal with any diseases that comes along. COVID was really affected Zanzibar. As you know, Zanzibar is a tourist destination. Our GDP, tourism contributes about 30% of the Zanzibar GDP. So with COVID, we were really tested. Our health facilities, our health systems were so weak that we had really big problem. So to conclude, I know you have particular areas where you can support us, but I want you to look into the systems themselves and see how best you can support us. So it's not like we are going into projects. You know, we can work with HIV, we can work with COVID, we can work with one of those diseases, but that will not, you know, have a sustainable impact unless we do the whole systems, you know. So this is my request to you. Commodities, the availability of commodities. It will be no, the issue is to have the appropriate medical equipments, but medicines and reagents for the labs, and it's important that we have a proper logistic system for this. So this is another area that we would like to ask for your support, how to make our medical stores or our central medical store here properly managed, both in terms of their procurement capacity, their storage capacity, and their distribution capacity. So this is another very important system that we want to build better. Following that, of course, comes the human resources. And this is where we need your assistance, because we need capacity building to develop the workforce. We will have so many new facilities that we will need a lot of new health workers and trained health workers, because unlike in the past, the bulk of the health workers were those who have no, you know, particular cadres. Now we are talking about doctors, we are talking about nurses, we are talking about anesthetists. Actually, we need your support to build that capacity, you know, whether it is in-house training or whether it is training outside the hospital facilities. But human resources is the priority next.
With the help of the United States of America, malaria in Zanzibar is now stable. It was about 40% of the disease in Zanzibar 20 years ago. It was malaria. If any patient comes to hospital with any other disease but must have malaria, and malaria was finishing everything. Like now, COVID, if everybody has got some problems, COVID is finishing him, children sick. This is how we're working with CDC. This is how we're working with the United States of America in our Ministry of Health.